Kia ora tātou, ko manga kiki te maunga, ko manakau te moana, no tāmaki makaurau ahau, ko Joanna Sinclair tōku ingoa. Nō reira, tēnā koutou, tēnā koutou, tēnā koutou katoa. Thank you for viewing this presentation about the Long Lives Healthy Workplaces Toolkit. My name is Dr. Joanna Sinclair, and I'm speaking to you from Aotearoa, New Zealand, on behalf of the Long Lives Healthy Workplaces Implementation Group. Thank you to the organising committee for the opportunity to speak. This implementation group has been meeting since May 2019, seeking ways to promote the toolkit and help others to implement it, as well as finding ways to share ideas and learn from each other. We've put together a suite of new resources for you, and it's my privilege to present those to you today in a virtual relaunch of the Long Lives Healthy Workplaces Toolkit. This is an overview of this talk. I'm going to begin by acknowledging the genesis or whakapapa of the toolkit, and then go over why we need a framework like this. I'll show you how it works, and then show you around our new resources and where you can find them. So, Long Lives Healthy Workplaces is an Australian-designed open access wellbeing framework that was designed for the wellbeing of anaesthetists special interest group, as indicated here by the logo for the Anaesthesia Continuing Education Committee, which, as many of you will know, is a tripartite committee including ANZCA, the Australian Society of Anaesthetists and the New Zealand Society of Anaesthetists. It was funded by the ASA and the Prevention Hub, which is an Australian federal government initiative that focuses on anxiety and depression research. The funds were given to one of Australia's leading mental health organisations, Everymind, who have expertise in developing mental health frameworks specifically for industries. And the work was guided by this outstanding steering committee, lots of very well-known names in the wellbeing sphere here, with the research and writing provided by staff at Everymind. So why did that group of people and organisations go to all this effort to produce 90 pages worth of resources and evidence, compiled after reviewing all the literature at the time, interviewing anaesthetists and focus groups? And why should you put your time and effort into implementing it? From the Beyond Blue survey in 2013, 1 in 5 doctors have been diagnosed with or treated for depression at some stage. 6% had a current diagnosis of depression and 4% had a current diagnosis of anxiety. 1 in 4 doctors had thoughts of suicide prior to the 12 months leading up to the survey, and 1 in 10 in the 12 months leading up to the survey. This is significantly higher than the general population and other professionals. Approximately 2% reported that they had attempted suicide. 1 in 3 medical students had thought about suicide prior to the last 12 months, and 1 in 5 in the 12 months prior to the survey. And in the US, in their studies, male anaesthetists have been shown to have 2 times the rate of suicide compared to other doctors. And here that is by graphical representation, showing that US anaesthetists are at significantly higher risk than other specialties. And you've probably noticed that I had a bit of a countdown going there, and maybe expecting the next number to be 1, but instead I have a 7. This talk was first presented in August 2018, and 7 is the number of probable deaths by suicide by Australian and New Zealand anaesthetists between October 2017 and then, so not even a year. But even if that number had been a 1, that's 1 too many and a death we would like to prevent. In addition to this, there are many other statistics we could put up around substance abuse, particularly alcohol consumption, around burnout, fatigue, and so on. There are other things the framework can help with, such as summarising the overwhelming volume of physician health research. And particularly now, post-COVID, a Google search throws up more than 300 million results when you enter in physician wellbeing. It can also help raise awareness of the need for wellbeing initiatives for consultants and trainees, and in public and private institutions. It can help you decide what's best practice in mental health and which strategies are most likely to have a long-term benefit for your people in your setting. And it can help you think strategically about implementation, which is a new way of thinking for many of us when it comes to organisational as opposed to clinical things. And that key message of the Long Lives Healthy Workplaces Toolkit is that need for a strategic and coordinated approach to improving workplace mental health and well-being. So what does that really mean? We are used to taking such an approach when it comes to physical illness. For example, if you think of cardiovascular disease, we're familiar with primary prevention strategies such as healthy eating and getting regular exercise. We're familiar with secondary prevention strategies like screening at-risk groups for diabetes. People in our communities know to call hospital emergency services if they're having severe chest pain. There's a whole system of pre-hospital and hospital care that's designed to resuscitate people, bring them into the emergency department, get them to cath labs and operating theatres when they have an acute coronary event. And then after they've had that acute event, there might be cardiac rehab or other community supports aiming to return people to a safe level of function. This toolkit, Long Lives Healthy Workplaces, encourages anaesthetic departments to take that sort of strategic approach to mental health, to have primary and secondary prevention strategies in place, and to know what the equivalent of calling 000 or 111 in the event of the mental health equivalent of an acute chest pain episode, to know what that equivalent is. The Everymind researchers conducted interviews in focus groups with Australasian anaesthetists and combined that with the research to develop 5 strategies to develop your departmental program around. Strategy 1 is to reduce risk by improving the study, training and work environment. Strategy 2 is to improve the culture of medicine, to better support wellbeing and to reduce stigma, which is a pretty huge but vitally important strategy, in my opinion. Strategy 3 is around how we recognise and respond to those needing mental health support and also suicide prevention services. And strategy 4 is to better support anaesthetists and trainees impacted by mental ill health and suicide. None of strategies 1 to 4 will be successful without strategy 5, which is why that's across the bottom. And that's leadership support, coordination and communication. This is critical to success. You don't have to work on all the strategies at once. Pick one to start with and check out the actions and activities you can take in the toolkit. This diagram is courtesy of Dr. Tracy Tay. It highlights the importance of both individual and organisational strategies, and that by organisation, we don't just mean our department or our hospital or health service, but we also mean our medical schools, our colleges, medical indemnity companies, medical councils, and so on. Anaesthetists are particularly at risk. We can be at the bottom level of this pyramid where everything's going great, we're sleeping well, eating well, exercising, don't have any relationship stress, and then an event can happen. We can make a drug error, a patient might be inadvertently injured under our care, or as a result of our actions. And then we can suddenly be right at the top of the pyramid in crisis mode, and this can happen at any time. We need to do better at putting strategies in place so that we know how to support our staff at all levels of this pyramid, not just the ones we find easy to sort out. For some departments, the barn door in your face crisis mode stuff is relatively easy, but the lower level stuff is more challenging to deal with on the fly. Implementing the toolkit can look very different for different departments based on the makeup of your department, the existing workplace culture, the setting and size of your department. The Long Lives Healthy Workplaces Implementation Group was formed to look at ways in which these various experiences could be shared for others to learn from, and also to develop resources that might assist other departments as well as our own. This is an example of an implementation pathway, and this is in our new resource toolkit. It starts with being interested, and hopefully that's why you're listening to this talk today. It's good to find friends to help us do this work and also gain leadership and executive support, and getting that executive support can be quite tricky. It's also good to know who will lead long lives healthy workplaces in your department who will have ultimate accountability. The first step is to do a needs assessment, and this might be a survey, it might be via face-to-face meetings, it might just be that you pick up a vibe that all is not well in your department. Or it could be that a head of department or a director gives you some instructions about needing to sort out X, Y, and Z, and that may be because they've done their own form of a needs assessment. From this needs assessment, we can identify a goal which is SMART. SMART stands for specific, measurable, achievable, relevant, and time-specific. And after the period that we set for that goal to be achieved, we would then review that. So an example of a SMART goal might be that you want 50% of your department to have been through mental health first aid training over the next year. Or you might identify that there are issues with getting people out for tea breaks during the day. And so you might say that in the next 4 months, you want to have achieved that all consultants working on their own or with a junior trainee will have been let out for a 15-minute break. And so then after that period that you've set with that goal, you would review and see whether you've achieved it or whether you need to implement some other strategies to achieve that goal. It's important to get some feedback as part of the evaluation, and that feedback may contribute to another needs assessment and another goal setting round, and so the cycle goes on. You can also see there in black some QR codes, and these will link you to resources related to the Long Lives Healthy Workplaces Toolkit. Included there is a QR code through to the implementation resources and also to the ASA forum, which is a place where we would invite you to go to share your ideas and your experiences, any new resources that you find along the way. You don't have to be an ASA member to request access to that forum. So I'll duck quickly into the main toolkit to remind you what that looks like, and then we'll have a look at the new resources. Here is a QR code that will take you to the full version of the toolkit, which, as I said, is 90 pages long, and the result of meticulously reviewing all the research available at the time, as well as interviewing Australian and New Zealand anaesthetists in focus groups. It incorporates the 5 strategies and is loaded with resources. These are Australian resources, though many of the websites have wide applicability and are therefore useful to those of us working in New Zealand as well. However, I have produced a New Zealand edition of the toolkit, and you can find that on the NZSA website and now also in the resource kit. And so this is a glimpse inside the toolkit. It's delivered in 4 sections as seen across the top of the image: an explanation of how the toolkit came about, the assessment tool and strategies, resources and supporting information. Evidence for each of the 5 strategies is included based on the literature and our qualitative interviews with anaesthetists. There are 13 actions underpinning the strategies and suggestions regarding how to achieve those actions along with supporting resources. And now I'm very pleased to show you what we've been working on. Here is another QR code, and this one takes you to the implementation resources on the ASA website. Again, you don't need to be an ASA member to access them. However, they will also be on the ANZCA website, on the Doctor's Health page, and the Library Guide for Wellbeing. So this is the landing page for the resource kit, and from here you can get access to a 4-page summary of the toolkit, which is great if you're speaking to leaders or executives, and there's also a 9-page summary version which gives you a good overview of the toolkit and the strategies. And then we have these sections of resources. So we have a strategic approaches section, which has that roadmap that I showed you earlier. It has a self-assessment tool, which is an interactive PDF file that you can go through. I'll talk about that again. And a number of articles that we think might be particularly useful for giving you some information about strategic approaches to wellbeing initiatives in the workplace. I haven't got a screenshot of it, but there's also a needs assessment tab that you can see there, and that has some suggestions for ways in which you can conduct needs assessments. And we are also working on getting you access to a copyrighted wellbeing survey, but that's very much a work in progress, so watch this space for that. There are the New Zealand specific resources that I mentioned. And there's also a tab for slides and videos. So there's a slide pack in there that might be helpful to you, along with presenter notes included, if you're presenting to your teams. And Dr. Susie New, the ASA president, has recorded a video to go with that, that will show you how to deliver that presentation. It's really well worth watching when you have the time. And as I mentioned, there's this action item checklist, which is an interactive PDF and just encourages you to go through all the strategies and action points. And you might be surprised to find how much you're actually doing that you don't necessarily label as a wellbeing activity. This will help you devise those SMART goals that I talked about and decide which actions you want to target within your own department. And the final QR code is for the ASA forum. Please share your progress and any questions with us on the ASA forum. You can ask questions of each other, of the implementation group. Please post any amazing resources that you find that you think would be helpful to other people. This is a secure website, and as such, sometimes it's a little bit clunky, but it's kind of like a Facebook page for the toolkit, if you like, and so it's a great place to get any updates and share. And the implementation group members keep an eye on it so that we can chase up on any new ideas and see if we can incorporate them into what we're doing. And as I said, you don't need to be an ASA member to access that. So thank you for listening and finding out more about the toolkit from the this lovely group of people who are the Long Lives Healthy Workplaces implementation group that we've been working with for a couple of years now. Special thanks to the ASA who've given us a lot of administrative support, and special mention to Media Officer Cindy Jones, who has been really helpful in preparing those summary documents. And also a special thank you to Mairead Jacques from ANZCA, who is a great champion of all things wellbeing for us anaesthetists and has been a great support to me as chair of the committee as well. My Twitter handle and my email are there, and I'm very happy to receive direct contact with any questions you might have as well. Ngā mihi nui, thank you.